California has now tallied more than 7 million coronavirus cases just 1 week after surpassing the 6 million mark. The latest numbers show 76,000 new COVID cases. That's about a 1% increase. Our test positivity stands at 21.1%. But this chart shows our 7-day average for cases appears to be trending downward, though the state says these numbers are not yet final. Hospitalizations and cases in New York City are dropping fast. The mayor credits the city's high vaccination rates for the success, with 16 million doses administered, including 2.5 million boosters. Joining us live now, UCSF Infectious Disease Dr. Peter Chin-Hong. Thank you so much for joining us, Doctor.
Always a pleasure, Liz.
Now, we're starting to see Omicron peak in some places like New York and globally like South Africa and the UK. They're a couple weeks ahead of us. Are we close to seeing a peak in California and specifically here in the Bay Area, do you think?
Well, Liz, I didn't want to jinx us, but I think we may be on a plateau right now. I think many people want to see a few more data points. But, test positivity rate is kind of coming down a little bit at the medical center. We've seen kind of a plateau actually since January 11th when I looked at our UCSF data. And we've seen the Santa Clara County's wastewater data, which already started to decline. So to me, all roads point to the fact that we're not going to see more increases anymore, which is a good sign.
Yes, be cautiously optimistic is always a good plan. Now, even when the Omicron wave peaks, it doesn't necessarily mean we're out of the woods. What kind of future do you see after it does peak and we're moving on? Do you see another variant popping up?
Well, it's hard to say, but certainly right now we are probably going to be a little bit, stressed at the health center level or the hospital center level for a few more weeks. But as a society, I think we're probably going to get a few months off back to regular sort of like times like June 15th, around that time, that level of, disease in the community. But then it's anyone's guess whether or not we're going to see a new variant come later in the year. I think what's very clear is that if you get a booster, even if another variant comes, you would be protected from going to the hospital with severe disease.
And are you seeing that the folks that get the booster, do you find that getting that third shot really did protect them from getting infected in the first place and certainly from getting sick?
Yes, definitely. I was in the hospital last week, and I would say more than 90% are still unvaccinated. And the 10%, I didn't personally take care of anyone who was boosted and then got into the hospital with COVID. Of course, people are coming into the hospital with a broken leg or some other illness and then happen to have COVID, but not for COVID in my experience so far.
Child hospitalizations reaching record highs as well. Schools struggling to stay open, as we reported earlier in this newscast. What is your advice to parents, especially the ones with kids who are too young to get vaccinated yet?
The main advice is to immunize as many people in the child's life as possible and build a wall of immunity around it. That means teachers, staff, grandparents, uncles, aunts, cousins, bigger brothers and sisters. That seems to keep the kids the safest. And of course, when they're in school, up the mask game. Try to at least wear a surgical mask, a pediatric size KN95, which tends to be a little bit more comfortable than an N95. I think that is going to be short-lived, the stress, because I think, again, like your first question, Liz, whatever is happening is going to happen very fast, and we're going to descend very quickly.
Dr. Fauci said today it's unlikely that COVID, though, will be eradicated completely. We're just always going to have it somewhere in the world. What do you think living with COVID will look like? They're talking about this in the UK, and that we're getting to a point where this is just going to be part of our reality, and we need to learn to live with it. Do you believe that's the case?
I believe that's the case, but we're not at that point yet. And the reason why is because there's still too many deaths in the U.S. Almost 2,000 deaths a day is not chump change. I think we need to either immunize more people, or more people have to get immune to drive down those deaths. Also, we have more therapeutics at hand soon, like the oral agents for COVID that may prevent hospitalizations, more monoclonal antibodies that will come on board. So I think all of these things working together, if deaths get driven down, I think we can then open up more confidently as a society. But again, 2,000 Americans dying a day is a little bit nerve-wracking, I think.
Yes, that's a devastating number. All right, Peter Chin Hong, thank you so much for joining us, always.
Thanks so much, Liz.